So we're going to be doing a manual muscle test on my girlfriend Emily here. So we're going to be doing the three main muscles in the lower extremity, so her hip flexors, her knee extensors, and her knee flexors. So having muscle weakness is a very common thing with patients with ALS, so it's important to get a good assessment of their strength. That way we can kind of go from there with their treatment session. So we're going to get started with the hip flexor manual muscle test. So what I want you to do is just hold on to the edge of the mat like you're doing. And then you're going to lift this left leg, this knee up toward the sky. So go ahead and do that. Great. Is that about as far as you can go? Okay. So I'm just going to put some pressure down here. I just want you to hold it for me and don't let me move it, okay? So hold. Okay. So she was able to resist minimally, so she'd be a 3+ out of 5 for the manual muscle test. So we'll go ahead and do the quads or the knee extensors now. So what I want you to do is I want you to just kick your toes out up toward the sky as high as you can. All right, back down. Okay, come back up again. And I want you to just hold it there. I'm just going to put some resistance down there and just don't let me push you down. Okay, hold there, hold. Okay. So she was able to resist minimally again, so she'd be a 3+ out of 5. And then last one, we're going to do the hamstring, so the muscle behind your leg. So I want you to bring your heel back toward the base of the bed there. Okay, and come back out. And back in. All right, so I'm just going to go ahead and try to pull you toward me. Just don't let me move you, okay? Hold. All right, so that's minimally again. So all three of her lower extremity muscles were previously a 3 out of 5, and they progressed to a 3+ out of 5. So we're getting there. Okay, so if I had to do like a treatment session, I would put like a cuff weight like this around her leg. So we'll go ahead and do the hip flexor one first. So I'm just put it right on top of her leg there. And I want you just to bring your hip up toward the sky here. And back down, back up. Alright, so since she was at 3+ out of 5, she's able to resist minimally. So this is kind of like that minimal resist. So she would do that about 2 sets of 10 until she's able to get stronger, and I could increase the weight of the cuff here to make it easier, or to make it harder. And then to make it easier, I would just have her do this normally without the cuff weight. So we'll do an exercise for the quads now. Just wrap this around. And then I'll have you kick your leg out again like we were doing. Let's try to keep up nice and straight. Kick your leg out. Perfect. And again, I would do that 2 sets of 10. Again, to make it harder, I would just increase the weight, and to make it easier, I would just take this cuff off altogether. And then we're going to do hamstring curls next, so I'll have you lay on your stomach with your head that way, please. And then I'll wrap that around her ankle and just have her do hamstring curls. So go ahead and bring this heel up basically up toward your head. Perfect. And back down, and up, okay, back down. Again, have her do it 2 sets of 10 until she gets better, then progress maybe to 3. And then to make it harder, I would just increase the size of this cuff weight again, kind of the same thing for all of them. Or to make it easier, I would just not do the cuff weight at all. And then hopefully strengthening these muscles will help her sit to stand transfer that she's having trouble with, and then eventually get her to be able to walk normally. Do you have any questions at all? All right.